Genetic analysis of clinical findings at health examinations of young Swedish Warmblood riding horses. Health status and soundness play a major role in the longevity of the horse. It is important for welfare and utility of a horse in work. Musculoskeletal disorders are the most common causes of interruption to training and of culling. Despite great importance, heritability of the major health traits in horses previously has not been estimated. The objective was to perform genetic analysis of medical and orthopedic health traits in young riding horses, including estimates of heritability and genetic correlations between health traits, and to reveal possibilities for genetic evolution of stallions for progeny health. Health inspections of all horses were performed in the same environment by one veterinarian, looking at medical status, mucous membrane colour, skin, mouth, lungs and heart. And the vet also looked at hoof and their hoof soundness, shape and quality. The second assessment was taken by a second veterinarian in the same environmental conditions, looking at effusion, swelling, soreness, heat and stiffness in anatomical locations of each limb. Each evaluation was scored out of 3, shown in this graph. Concluding the results of breeding values and calculating the heritability of these bad traits in young riding horses. The heritability of these traits was estimated by records from 8,238 Swedish Warmblood riding horses examined at 4 to 5 years of age at the Riding Horse Quality Test from 1983 to 2005. The analysis were performed using multi-trait linear mixed animal models. The heritability of orthopedic health and hoof examination results. The genetic variation in these traits resulted in distinct health differences between progeny groups of stallion. The highest heritability among clinical signs of orthopedic health was found synovial effusion. The systematic location joint-related findings had the highest heritability. The heritability of medical health and locomotion examination results were low. A genetic improvement for health status has occurred over time, but accounts only partly for the decrease in clinical findings of health during the study period. The genetic variation found in orthopedic health and hoof implies distinct differences in progeny groups in Swedish Warmblood population, shown in graph 2. Thus, there are possibilities of improvement in these traits in population through selection. The weak and non-significant correlation between placatory and orthopedic health and hoof suggests that both traits need to be selected for particular breeding to improve both traits. Some genetic improvements over time have already been achieved, possibly due to the regular stallion health inspections and indirect selection of lifetime performance.